So, a colonoscopy is a method for assessing the condition of the inner lining of the large intestine. It's a diagnostic procedure where a special tube with a video camera at the end is inserted into the lumen of the intestine. This is a modern method of colonoscopy. And with the help of this video camera, the endoscopist doctor can directly examine the entire large intestine from the very beginning to the very end, that is, through the rectum. During this examination, various growths may be found on the wall of the large intestine. Most often, polyps are discovered. Polyps come in different types, and not all of them are dangerous. The most common are hyperplastic polyps. These are, essentially, a thickening of the inner lining of the large intestine. They are not dangerous. It's normal colon mucosa that just happens to be layered several times in that particular spot. There are also adenomatous polyps, which form from special cells in the lining of the large intestine. The overgrowth of these cells leads to the formation of such growths, which, if they are larger than 1 centimeter in diameter, and sometimes polyps can be 2 or even 3 centimeters, on the outside, they look like a head of cauliflower. They have a lobular structure and a whitish color. They can be on a long stalk and look like little mushrooms inside the lumen of the intestine. This is easily detected during a colonoscopy. Usually, the endoscopist will always note the shape, size, and presumed structure of the polyp in the colonoscopy report. The final diagnosis is also determined by the results of histology, when a piece of the polyp can be biopsied or the entire polyp can be removed, and then it is sent for histological examination, where a pathologist determines the nature of the polyp and whether there are any malignant cells present. It is specifically adenomatous polyps that most often have the potential to turn into malignant tumors. Why does this happen? First of all, there are certain genetic factors that can contribute to this. People whose relatives have had colon cancer or other oncological diseases, especially if it happened at a relatively young age, like 40 or 50, have a much higher risk, first, of developing adenomatous polyps, and second, of those polyps turning into malignant tumors. Secondly, there are environmental factors, what we eat, what we drink, and how physically active people are. These are also very important factors in the development of colon cancer. Our mental and emotional state, how much a person worries, their level of stress, these are also risk factors for certain genetic mutations to accumulate in a polyp at some point, causing it to turn from benign to malignant. And then, depending on how far the malignant cells have spread within the polyp, it is determined what needs to be done with that polyp. Will it be enough to simply remove it endoscopically, that is, during a colonoscopy, or will a more extensive oncological surgery be required?